Knox Community Health Service, nestled at the foot of the Dandenong Ranges, delivers a variety of services that improve the physical, mental and social well-being of individuals, families and communities in the City of Knox. One such service is the Alcohol, Tobacco and Other Drugs Counselling Team. Sitting within this part of the service is the Improved Services Initiative, a federally funded initiative which aims to support services in providing an improved, integrated response to individuals with co-occurring alcohol and other drug and mental health problems, also known as dual diagnosis. In this short film trailer about the journey from capacity to dual diagnosis capability, you will hear excerpts from the coming film from Knox Community Health Service, in which their staff and staff from some of their key partner agencies talk about the impact this initiative has had on their work.
At Knox Community Health Service, we've been the recipients of the Improved Services Initiative grant that's enabled us to build capacity of our AOD treatment team to be able to work with mental health issues and to work more collaboratively with mental health services. This grant has really helped us to embrace the no wrong door policy, and we've been able to do that through a range of activities which this video will showcase. We're hoping to share what we have learned along the way. This grant has really transformed our service, and over the last 3 years we've been able to change practice by looking at systems, policies, training needs and partners that we require in order to get the best outcome for clients with co-occurring conditions.
Capacity building, I see, is a way of improving service delivery without necessarily increasing the cost or gaining more funding, expanding what you can do as a service more effectively and more efficiently. And so it happens at several levels. It can happen at the individual worker level and also at a team level and even across organisational level. So expanding what's happening in the community with lots of services working together.
So capacity building to me would be around developing knowledge, skills, capacity obviously to deal with dual diagnosis clients.
Capacity building has been really important for my work with clients. Some of that involves getting GPs involved, mental health services, really looking at each individual as a whole and what might they need that will support their recovery in alcohol and drugs.
Capacity building to me is the opportunity for our staff to develop particular therapeutic styles or interventions that increase their capacity to work across a broad range of clients that they have.
Yeah, secondary consultations, so you guys come every 6 weeks. There's been a different member from each of your team, which has been great because there have been different skills and experiences that are brought to our conversations. It's really made us talk about drug and alcohol openly and get ideas from each other, and it's brought it to the table and keeps reminding us each time we have the secondary consults. It's always part of our work now. Then we've had the training with motivational interviewing and also with ACT, and both of those have been great for us as a team and for myself, I think.
We've done capacity building in terms of training, ACT therapy training, secondary consults with a lot of the ATOD team as well, and one-on-one consults in regards to ringing up Knox Community Health Service and finding out if services are appropriate for a lot of the clients we work with.
Been in previous roles where there wasn't that linkage with another organisation, it was a sort of fumbling in the dark type of situation, but now with our relationship with Knox, that's really improved, and also just with the way that dual diagnosis has been emphasised and prioritised as a really key, important entity, I guess, within Eastern Health, has brought about improvements there, and I feel personally that I've benefited from sort of greater exposure to the knowledge that's out there.
We have found through that partnership it's been a really helpful tool for us if especially with new clients and we're not sure where to go and what services that may be useful for them. It's fabulous for being able to have that kind of partnership where we can pick up the phone first and say, this is what's going on for this person, and get some help and some ideas, especially too if it's something that's not suitable for your service, then we're able to get some other ideas of where we can then look at going.
Every time that we sit down with our clinicians and we talk about priorities, we do team planning days, usually number 1 or 2 on the team's list of priorities, professional development. They want to be better clinicians. They want to have tools that will help them in their work. So this has been fantastic because we have an opportunity to skill up our workforce, and they feel so much better.
What the Cran's done for me is give me a very clear sense that we're on the same page with mental health services. That is one of those tools, I suppose, that crosses the paradigms, that brings that work together, where if the mental health service is using the same form, we can clearly look at that and say, well, this is what the risks are and this is how we're responding to them and who's responsible for that.
I let the client know before I do the MMS with them that at the end I'm going to tell them what it's telling me, because at the end of the MMS I want them to tell me if that fits their experience of themselves.
Yeah, I'm a big fan of shared care. There's been a big push, particularly from Eastern Health, in shared care and the IRPs and everyone being a part of that. And I think that it's worked very well. And I think we're having much closer ties with Alcohol and Drug Service and also with area mental health services, which has been great. So this everybody knows what they're doing. We're not doubling up.
That sense of relief that services are working together for them, rather than being the criteria being so different for each service.
In order for any sort of referral arrangements or sort of smooth, consistent service provision for a client, you've got to have a minimum of gaps. Building motivation for people with addictions, you need to be able to strike when the iron's hot.
Just the confidence that we bring that as workers to talk about their addictions, and we're not shy about it, and we're open with it. I think it's given us confidence that when we've brought it to the table and it's been opened and named, then we know where to go with it from there. We can sit with it as well ourselves, rather than saying straight away, okay, I'll direct you to an AOD worker, which is what we did in the past. As soon as someone mentioned alcohol and drugs, then the referral will be put in the next day.
I think it engenders a real sense of confidence and security in the client to know that everyone that's supporting them is working together and that there's really open and clear communication going on. The training that we've done with ACT and motivational interviewing has meant that there's also a consistent approach in how people are being supported, that there's not a clash of cultures, there's a similar culture happening in the teams, and so clients are being presented with a really harmonious style of approach, and I think clients benefit from that. It takes out confusion, they feel security, it's really clear who's doing what. We're drawing on specialists where needed, but that's being supported by the other services as well.
Here we have heard real stories from staff from across alcohol and other drug and mental health services. In the coming full version of Capacity to Capability, you will hear from a broader range of services associated with the Knox AOD Improved Services Initiative project, including staff, consumers and carers, discussing in greater detail the impact of capacity building and the role it plays in the development of dual diagnosis capable service delivery.